Hi guys, so today I want to talk about why do assessments for real legit diagnostics of DID take so many years and why must they be done? And so I'm going to be reading what I typed out about this process and how important it is. I want to say that most, if not all, those with the disorder are unaware of it or are ashamed of it till later in life. Most, if not all, are unable to cope with its debilitating ailments. These ailments come in two forms. Number one is the mental health aspect of it, which can bring amnesia, headaches, flashbacks, images, sights, sounds, and smells that can trigger high intense switches or an altercation of identity. Over time, you will find the symptoms begin to get worse to the point you can't live with them. You begin to feel like you're going crazy, and time seems to disappear, only to bring you back to an unknown location. Number two is the physical ailments of DID. Because of your body always being in a fight-to-flight response, this can cause hypertension, panic, startle responses to noises, and with that comes the body's need to shut down, hence the book, Waking the Tiger, which explains how this is also present in wild animals who are captured. Over time, alters can put the body into some real health issues. This issue is also shown in real medical research. Alters can have changes in heart rhythms and body temperatures. Alters can change vision, body posture, thyroid levels, brain waves, blood pressure. Even in my own experience, things can change like white blood cell counts, speech patterns, and altercations showing variations of writing. Most, if not all, people who suffer from this rare disorder do not display huge changes in variations of clothing, style, or makeup. If this was something we had to do daily, it would become more traumatizing trying to display alters in such styles that day-to-day functioning would be darn near impossible. However, if you know someone well enough, you can depict a change in style and clothing that goes usually left unnoticed. Alters do collect safe items like clothing and yes, even toys or jewelry to comfort needs to make them feel safe. For me, an example of that is perfume. My therapist introduced us to perfume in order to trigger good, safe routes. This helped smaller alters to know if it's safe or not to be out. It also gave alters a way to express themselves without no one knowing they were using the perfume for a safety measure in public settings. Those close to me know that this disorder is usually enabling, and it can change appetite, speech, posture, body energy, skill levels, etc. But the main thing at hand, and that is, before you even decide you have DID, most, if not all, those with it go through years and years of tests and assessments. The problem with this is some therapists or counselors don't consult a specialist on DID in order to rule out other mental health ailments. This can lead a patient into believing they actually have the disorder after a few tiny assessments, without even ruling out the other issues. All assessments should be done by a psychologist. The process of this needs to be planned very carefully. A therapist or mental health care professional, as always, should get to know the patient first and to make sure the patient is in a safe place to begin figuring out their diagnostic. Once trust is established, it is time to move into more assessments like finding out if the patient has PTSD or CPTSD. This can rule out other issues because usually PTSD is one solid painful traumatic event. CPTSD, however, is multiple traumas over a lifespan. This can include issues like childhood sexual and physical abuse, For sufferers, that is usually a common ailment that comes with dissociative identity disorder. Then there's other things like neurology that can help you rule out things like head injuries, brain lesions, tumors, sleep deprivation, drugs or intoxication, medicational side effects, and even things like metals and mildew exposure. These all must be ruled out before any diagnostic of DID can be presented. Once there is no physical sign causing these DID symptoms, the next step is to rule out any other mental health disorders. This can be a long process and can be very confusing. Some only can get solid evidence with an inpatient stay, due to some patients hiding the disorder so well that no hour-long session is going to pick up on symptoms. But once other disorders that display dissociative issues are ruled out, the healing can be done and set to fit your needs. The disorders that are usually ruled out first are BPD, which is borderline personality disorder, DPD, which is dependent personality disorder, OCD, schizophrenia, bipolar 1 and 2, panic disorders, OSDD, which is other specified dissociative disorder, Munchausen syndrome, and yes, even factitious disorders must be ruled out. The issue at hand is most, if not all, DID sufferers have been previously diagnosed with one of these disorders before getting a DID diagnosis. That's crazy, isn't it? Most, if not all, that suffer from DID have multiple ailments like anxiety, eating disorders, self-harm, insomnia, panic attacks, enmeshment issues, and even small things like fears that normal people would not bat an eye to. You will also find most people who suffer from DID don't do well with medications. The side effects on a normal person seem light compared to someone who has DID. Why? Because when altered in age, medication can process differently in different alters/parts. This can lead to confusion, suicidal ideation, self-harm again, and altercations in body functioning, etc. Over time, some sufferers have nerve issues, such as fibromyalgia and POTS. This seems to be some common ailments among those that have DID, but if you think about it, it does make sense since the switching goes to different parts of the brain, which logically can put a strain on your vagus nerve. This also controls other parts of the body's functioning. This affects the guts, digestion, etc. This can lead to other issues like IBS, Crohn's, diverticular disease, and diverticulitis. So, keep in mind before wanting to get a diagnostic of DID what comes with it and what the process is. Personally, as someone with the disorder, I think I would prefer not having it or displaying it as a such fun trend, which seems to be popping up on media apps more and more. I have found over the years that it is best to learn to reparent yourself in order to heal from this debilitating disorder. I also found those that specialize in EMDR, CBT, DBT, and EFT make the healing process move just a bit faster. Psychotherapy, more or less. Most, if not all, sufferers find that the healing of this disorder can also take up to 5 to 10 years, if not more. Some don't even integrate and find simply that having partial awareness and teamwork on all alters seems to stop some of the debilitating symptoms. The idea behind that is to learn to trust your alters and to open up to memories that they hold for you. There is also the need to up therapy time to more than 1 hour a week. I know that that is standard practice with most mental health disorders, but for DID, keep in mind there is more than one personality that you are treating up that time for them if they have the disorder. It will make their process less agonizing. Good luck to all, and I hope you found this helpful and useful for your journey. Loves. Bye.